an ECG on the patient's medical record. Gather all equipment and bring to bedside. Perform hand hygiene. Put PPE if indicated.
Good morning, Mom. Si Kara Di Mario Grace Lily, 25 years old.
Close curtains around bed and close the door to the room if possible.
Mom, what we will do is assess the record, the heart electrical activity, and it may be repeated at certain intervals. So don't worry, Mom, kasi you will not feel anything. And it only takes 5 minutes for this test. So, Ma'am, can I ask, do you have any allergies? Okay, Ma'am. So, if wala ka pong allergies, we will now proceed.
Place the ECG machine close to the patient's bed and plug the power cord into the wall outlet. Raise it to comfortable working height, usually elbow height of the caregiver. Have the patient lie supine in the center of the bed with the arms at the sides. Raise the head of the bed if necessary to promote comfort. Expose the patient's arms and legs and drape appropriately. Encourage the patient to relax the arms and legs. If an area is excessively hairy, clip the hair. Do not shave hair. Clean excess oil or other substances from the skin with soap and water and dry it completely. Apply now the limb bleed electrodes. Connect the limb bleed wires to the electrodes. The tip of each wire is lettered and color-coded for easy identification. The white or RA lead goes to the right arm, the green or RL lead to the right leg, and the red or LL lead to the left leg, and the black or LA lead to the left arm. And make sure the metal parts of the electrodes are clean and bright. Place now the chest or precaution leads. The first one is the V1 and V2 placed in the fourth intercostal space at the left and right external border. To place this, find first the supraesternal notch, then move down to the ridge called the angle of blue ear external angle. Then move to the side. Here is the second external space, and third intercostal space over the fourth rib is the fourth intercostal space where we will place the V1. V2 will just go to the left, still in the fourth intercostal space. V4 is placed next. This is the mid-clavicular line in the fifth intercostal space. To find the clavicular line, look one end of the clavicle and other end of the collarbone. And imagine that there is a midpoint, draw a line down until the fifth intercostal space where we place the V4. V3 is easy because it goes directly between V2 and V4. V5 goes in the anterior axillary line in the front portion and draw an imaginary line down and is still in the fifth intercostal space. The last is the V6 in the mid-axillary line or in the middle of the armpit. Level with the V4 is still at the fifth intercostal space. Connect the limb lead wire to the electrodes and make sure the metal parts of the electrodes are clean and bright. The tip of each lead wire is lettered and color-coded for easy identification. The brown or V1 to V6 leads are applied to the chest. After the application of the all leads, make sure the paper speed selector is set to the standard 25 meter per second and make sure the machine is set to full voltage.
Relax ka lang. Ang siniganda nun, ay ayos ka lang normal.
Press the auto button. Observe the tracing quality. The machine will record all 12 leads automatically, recording 3 consecutive leads simultaneously. Adjust waveform if necessary. When the machine finishes recording the 12 ECG, remove the electrodes.
Udah. Kagak. Ditapay.
Clean the patient's skin if necessary with adhesive remover for sticky residue. After disconnecting the lead wires from the electrodes and after cleaning the patient's skin, Return the patient to a comfortable position. Lower bed height and adjust the head of the bed to a comfortable position. Clean ECG machine per facility policy. If not done electronically from data entered into the machine, label the ECG with the patient's name, date of birth, location, date and time of recording, and other relevant information such as signs and symptoms that occurred during the recording. Remove additional PPE if used, and perform hand hygiene. And lastly, document all your findings.